Hello, my name is Dr. Kit Wu and I am a consultant neurologist based in London. Today I'm going to talk to you about Parkinson's disease. So, what is Parkinson's disease? Well, here is an interesting medical history fact for you. It was first reported by a London surgeon called James Parkinson almost 200 years ago. And he called it the shaking palsy because he noticed that patients consistently presented with tremor in one of their hands. Our medical knowledge about Parkinson's disease has come a long way since then. Medical research has helped with this. We now know that in Parkinson's disease, the dopamine-producing nerve cells in the area of the brain called the substantia nigra dies off. And dopamine is really important for maintaining smooth movements and coordination. And here is an interesting fact. By the time that the first motor symptoms of Parkinson's present, one would have lost about 60% or more of the dopamine-producing cells in our brain. So what are the symptoms of Parkinson's? When you picture Parkinson's disease, what comes to mind first? Tremor, right? That is a common symptom, often starting in one hand at rest, but not everyone gets a tremor. Symptoms can be broadly divided into non-motor and motor symptoms. The motor symptoms are tremor, normally at rest, starting in one hand or worse in one hand compared to the other, bradykinesia, which is slowness in movement, and rigidity, which is stiffness. And later on, patients also get postural instability, and that puts them at risk of falls. But it's not just the motor symptoms. Research has really advanced our understanding of the condition, and many Parkinson's patients experience non-motor symptoms. People can experience loss of smell, constipation, low mood, depression, anxiety, even years before a tremor begins, sometimes by more than a decade. These symptoms are hidden. They're called non-motor symptoms, and therefore we often refer to them as the Parkinson's iceberg. So what causes Parkinson's disease? One of the most common questions I get asked by patients in clinic is it a genetic or environmental cause? The majority of cases are idiopathic, meaning we can't pinpoint a single cause. Age is the strongest risk factor, and most people present above the age of 60 years or older. Younger onset Parkinson's are becoming more common. Some environmental exposure, like certain pesticides and heavy metal, no, not the musical type, but substances like lead and manganese, can put people at risk of developing Parkinson's disease. Most of the time, we don't know the cause though. However, the symptoms and the management approach are broadly similar. It is important then to look at how we diagnose Parkinson's and how we treat them. So in terms of diagnosis, I have a trick question. Can you name a single blood test that can confirm Parkinson's disease? The answer is there isn't one. And therefore, the diagnosis of Parkinson's is broadly based on a combination of your symptoms, the clinical history, and examination. So it's really important to have the expertise of a specialist for the correct diagnosis so that they can put the patient on the correct treatment pathway. Because each patient's symptoms are different and the condition affects individuals differently. And so treatment could be personalised to the symptoms and tailored to the individual. The treatment plan will incorporate roughly medication, especially levodopa, which is one of the mainstays of oral medication. And this gets converted in the brain as the active ingredient, dopamine. Exercise and therapies are very important as well. Things like physiotherapy, occupational therapy, and speech therapy can target different aspects of Parkinson's symptoms. When the disease progresses to moderate to severe, we can consider advanced therapy, which is a group of therapy modalities that incorporate surgery such as deep brain stimulation or continuous levodopa infusion, either via pump into the stomach or under the skin. Even with treatments, symptoms can change over time, so ongoing, regular specialist review is really important. So in summary, Parkinson's is far more than just tremor. It's a complex condition that affects every aspect of a patient's life. And we need to be aware of this and manage them in a holistic approach so that we can enable patients to live longer and better so that they can continue to do the things that they love doing.